So who needs a bone graft? Like in what scenario would somebody need a bone graft?
So whenever you have a tooth extracted, the bone is naturally going to collapse in, and it's going to get smaller and smaller over time. So if you're thinking about replacing that tooth at some point with a dental implant, or even a bridge, you want that bone to be maintained. And that's where a bone graft comes in.
Okay.
What we do is we take the tooth out, and now we're left with a socket, an empty space. And we fill that in with a little powder that we get from a jar, a company. It's not coming from the person's bone themselves. And we put it into that socket, and that allows their own bone to grow into that socket faster and better. And so when we come back a few months later, that powder that I put in is no longer there. It's all filled in with their own bone. And that will allow that bone to be preserved for a longer period of time. If they decide to go forward with a dental implant, or even if they're getting a bridge, it'll help contour, keep the proper contour under that bridge.
So what about pain? It's not really a painful procedure?
Yeah, not at all. I mean, we do it right at the time of the extraction. Usually the extraction may cause a little bit of discomfort, but the bone graft will not cause any discomfort.